Good evening, class. Good evening, professor. My name is Casey Sanders, and my controversial topic is debunking coronavirus myths. So for this speech, we're actually going to focus on the face masks, the gloves, the social distancing, and the hand sanitizing procedures. What I'm talking about here in the beginning is that it was implemented June 18th, 2020 by Governor Gavin Newsom that California had to wear face masks or face coverings. They're pretty similar. A face mask is filtered, a facial covering is usually just a cloth covering. Now, according to the CDC, a facial covering must enclose your nose and your mouth and be secured to your head without the use of your hands. So you cannot just pull your shirt up, you can't just take your hat off and cover your face. No, it has to be secured to your head without the use of your hands. Facial coverings and facial masks must be worn all times when you're outside. You can't practice proper social distancing, which is 6 feet apart, or you are not with your family members in your household. So if you're with your sister and your brother and you all live in the same household, you don't need to wear them. It is still recommended. Now, if you're with your cousin and your friend, you need to wear them because you're not in the same household. The way that the CDC says that this disease is spread is respiratory drops. So a respiratory drop is a piece of mucus or saliva or some kind of transferable liquid that the coronavirus lives in, transfers from you when you cough, when you sneeze, when you talk really loudly, because I'm sure some of you guys have had some conversations where you remember you yelled and all of a sudden spit comes flying out. That in there could be the coronavirus. So with those, it transfers from you to another person and then is either ingested or inhaled by that person. And there you go. That's the spread of the coronavirus. So if I wear a mask, my friend wears a mask, we can both talk safely with minimizing our chances of the spread of this virus. So that is actually true. With these face masks, even if it's a facial covering, not a mask, it does help you reduce the spread. Another one you might ask yourself is, why is this all important? Why do I need to worry about masks? Why do I need to worry about gloves? I have no symptoms. I feel fine. Why does it matter? Okay, well, I'm here to tell you that it matters because it's not only affecting San Diego, it's affecting the entire state of California, the entire country of the US, and the entire world. Our entire world, and I give this speech right now, tonight, is infected with coronavirus. Not every single person, but a good majority where it put our whole world in a state of pandemic. So, you might be asking yourself, well, this doesn't really affect me. I don't really think this is a big deal. Okay, but I'm here to tell you it is. We have top performers like the World Health Organization and the CDC, who are the foremost experts in these. This is the advice they give us, right? One of the big ones is facial masks and facial coverings. It's recommended and required to wear them in certain areas. Another thing that to keep in mind, though, is that's only part of controlling this spread. The other way to control this spread is with proper hand washing techniques. So you get your hands, soak them all up in the warm water like mom and dad taught you, 60 seconds. Warm water, sing happy birthday a couple times, hit both sides. Clean, good to go. Rinse them off with a clean towel, not the one that might have coronavirus on the floor. Then, there's another one that you can maintain your social distancing. Now each state's got a little bit different. Here in California, currently as of tonight, it's 6 feet apart. So you can't have groups larger than 10 out in public settings, and you need to be 6 feet apart. So, you might think, well, here, 1, 2, 3, 4, 5, 6, good to go. Okay, from that person. But there could be a person over here, could be a person over there, could be a person back there. 6 feet apart and a circumference around everybody. So that's another way to help. And the most commonly ignored one, and actually the most expensive one, is disinfecting common touch points and surfaces. Now this one's a little bit more expensive because you gotta buy Lysol wipes, you gotta buy a cleaning solution, you gotta buy hand sanitizer, you can even get the medical grade disinfecting tape that you gotta replace every once in a while. But this does help tremendously as well because you're killing off those surfaces. I don't know if you know this, but coronavirus, depending on what surface, can live up to 21 days on one virus. I mean, someone could come by, just rub their nose, touch a door handle. You can come by 2 weeks later, touch that door handle, you could get it. Okay, I think I do see a question in the audience. Ma'am, did you have a question?
Is wearing gloves as effective as wearing a mask?
All right, so let me repeat that for the people in the back that didn't hear it. She asked, is wearing gloves as effective as wearing a mask? So to answer your question in short is no, it is not. Now, if we want to explain that a little bit further, wearing gloves is a thing that medical and healthcare professionals do to prevent cross-contamination. So in their field, they deal with multiple patients every day. They have to, put gloves on, deal with one patient, remove them, throw them away, put brand new gloves on before they deal with another patient. That's in case patient 1 has coronavirus, patient 2 it is not spread to. So for their field and their profession, yes, it is recommended and even required in some places to wear gloves and change them out frequently. Now, however, for the general public wearing gloves, what happens there a lot of times is people don't change them out, people don't wash them, they wear the same gloves, and really all it's doing is furthering the spread or furthering bacteria that you might not have encountered on your hands before the gloves. So think about it this way, right? You put your gloves on in the morning, you go drop your kids off at school, you touch everything to get them out of the car, you touch their door to get them into school, then you come back and you get back in your car, you touch your steering wheel, then you go to the store and you buy stuff on the shelves and you touch that all, and you come back and touch your steering wheel again, and then, oh, it's time to change my gloves. Okay, so here, let me change them out while I'm driving, put my hand on my steering wheel, next thing you know, it's all on your hand anyway. And you're touching your face. It's just not good to wear gloves unless you're actually in the healthcare field and profession, you're practicing proper cross-contamination procedures. Whereas a mask does limit it because the mask is blocking your nose and your mouth, which are the two main entrances for germs through breathing or through talking, eating, and drinking. So to answer your question, no, gloves are not as effective as wearing a mask.